we've had numerous calls where we've made it to the patient and then we've just waited for a helicopter extrication. So rather than do that return, portage canoe, which is very hard with a patient that's not ambulatory, we'll just like wait for a window to open up where they can come in and pull us out, which is, ultimately it's the best for the patient. It seems like a delay, but it's actually not really a delay because it would take so long to affect that transit back with having to, manage a patient across portages that's in a basket. Like it's a nightmare. Like we train on that a lot and it's very bad. It's hard to do. So that's the kind of stuff that, it looks like. And then within the Algonquin thing, you do not have to be like way deep in the park to make it a hard extrication. Like they have so many hiking trails off of Highway 60 that people are always like, we're always helping out with pulling people out of there because, you roll your ankle and you can't walk, you're 2K in, like that's still a problem. Like that's a difficult extrication. So like we're always doing those calls with them as well. And sometimes we'll even use the helicopter if it's going to be too much. Like it's not so much the severity of the patient. It's just like you increase, like from a risk managed approach, when you're doing a ground evacuation, the risk to the rescuers is really significant when the terrain is not smooth. Like there's a lot of potential for injury along that. And it takes a long time to move a patient when you're not, when you don't have really good terrain and ground. Like when we're game planning these calls and we're thinking about our responses, like the guideline we use is that, it takes an hour to go a kilometer on good terrain with 8 people and a basket. Right. So if they're 6K in, right, like this is now a big deal. Right. So that's the kind of, all this stuff comes into play as we're putting our strategy together of how we're going to manage this call. So, and this is where all the other agencies start to come into play. Like the parks will get some of their folks out, and the OPP are amazing. Their ERT team is so, like, they've helped us in the last week so many times because they show up in force and they've got bodies and like muscle and you know what I mean? Like it makes a huge difference. So yeah, it's kind of pulling that all together is the key. That's the tricky bit.
So if you find this work valuable, the simplest way is to support the podcast by subscribing and sharing it with someone who'd benefit. And I want to recognize and acknowledge Casper, which is the Canadian Ambulance Service, Paramedicine, and EMS Research Repository. It's a free, open access platform making paramedicine and EMS research more visible, usable, accessible, and operational across Canada. So a huge credit goes out to Dr. Alan Batt and the team for leading the work and advancing open science in EMS. This podcast is for educational and informational purposes only. It is not medical advice, does not establish a standard of care, and must not be used to diagnose, treat, or manage any medical condition or emergency. The content discussed reflects general principles that may not apply to every situation, system, or patient. Clinical practice varies by region, service, and jurisdiction. Always follow your local medical directives, clinical guidelines, protocols, and the instruction of your medical oversight or base hospital physician. The host, guests, and producers make no representation, guarantees, or warranties regarding the accuracy, applicability, or completeness of the information shared. The views expressed are those of the individuals and do not necessarily reflect those of their employer, regulatory bodies, or medical oversight authorities. By listening, you acknowledge that the host and guests assume no responsibility or liability for any actions taken or not taken based on the content of this podcast. This material is intended solely as a supplemental educational tools to support ongoing professional development, not a substitute for accredited training, certification, or authorized clinical guidelines.